You're listening to Plug Into Health with Prevea Health, exploring healthcare topics that matter to you, the latest developments in health and medicine, and the inspiring stories that emerge from Prevea Health, our partners, and the communities we serve. Welcome to the Great Doctors Inspiring Stories series on Plug Into Health. On this episode, you're going to meet a Prevea Health doctor who has made it her life's work to help children fight cancer and blood disorders. That in itself is inspiring, but there's more to the story here, and we're so glad you've all chosen to hit play on this one. So with that, let's welcome Dr. Cathy Long, Pediatric Hematologist-Oncologist with Prevea Health and HSHS St. Vincent Children's Hospital. Thank you so much for joining us, Dr. Long.
Yeah, thank you for having me.
So the first thing I'm hoping that you can do is paint a picture of what you do as a pediatric hematologist-oncologist and what a typical day might look like for you.
Yeah. So as you kind of mentioned, a hematologist is somebody who treats blood disorders, and the oncologist part is somebody who treats cancer. And so I get to see a variety of patients in a variety of settings, which is nice. So there's two kind of settings that I get to practice medicine, and one is our clinic. So on a clinic day, I will see patients that are getting chemotherapy for their cancer treatment. I'll see patients that are getting follow-up for their blood disorders, and I'll see new patients that are here for a consult to say, what is going on potentially with the blood disorder. And then on other days, I'll be on the inpatient service where I'm seeing the kids that are in the hospital, again, maybe getting treatment for their cancer, in with complications for their cancer or in for other things. And then I spend a lot of my day as well following up on what other things need to be done. So I'm writing chemotherapy orders and touching base with other physicians to make sure that we're coordinating care for our kids that need surgery and other things. So it's a variety of things that keeps me busy.
Yeah, and really these are children of all ages and children fighting all different kinds of illnesses. There's so many different types of blood disorders, so many different types of pediatric cancers.
Right. So there's quite a variety. And we see not just children, but young adults as well. So we have some patients that are sometimes even up to 30, depending on a diagnosis. If they have a more pediatric type of cancer, we'll see them and treat them. So you really get a wide range of things. And I will also say a lot of times families will be very nervous if they're referred to see the oncologist. But I do so many other things other than cancer. And so I always want families to know that just because you're coming to see us doesn't mean something horrible is going on.
Mm-hmm. I'm thinking you probably get this question a lot. You painted a picture a little bit of what your day looks like. And I imagine that a lot of that time is spent with these patients, whether they're children or young adults, their families. They are going through something incredibly difficult. Is that challenging for you, or how do you cope with that?
So it's not as challenging as a lot of people think for me, and I think that's because it's such a rewarding job and I love doing it. There are definitely really hard days. Nobody wants to be the one to tell their parents that their child has cancer. Those are really hard days, and that is a challenge. But most days, that's not the conversation I'm having. Most days I'm seeing kids and their families, and we're, talking about how they're doing, and kids are so resilient and happy most of the time, and most days are thankfully not the super challenging days.
What is the most rewarding part of your job?
The most rewarding part is just helping the families through that difficult time. So knowing that I can be lessening that burden a little bit and helping them, with our experience and just guiding them to kind of know what to expect and to know that the vast majority of the time they're going to get through this and they'll be fine on the other side, and kind of helping them along that journey.
If you look at incidence of childhood cancer right now, is this something that has increased, or what does the state of that sort of look like right now?
So I think that it might be a little bit increased overall, but not a huge amount. I mean, the nice thing about childhood cancer is that it seems that we're getting better at treating it all the time. So compared to, 20, 30, 40 years ago, we're better at treating it, meaning in the vast majority of our patients are cured. So in childhood cancer, really about 80% of the patients are cured from their cancer and it doesn't come back. So that is a great and hopeful thing.
I want to get to the why that you chose this career. It's truly something that the first time I learned about it, which was several years ago, really made me pause, and I've never forgotten it. And it stems from your childhood. And so before we get into it, what I'm hoping you can do is just first tell us a little bit about where you grew up and the family you grew up with to sort of set that stage a little bit.
Yeah. So I grew up in a small town in central Illinois called Rantoul, which is a very weird word for those that have never heard it before. It's about 2 hours south of Chicago. And I grew up with my parents, Denny and Ann, and I have an older sister, Jennifer, who's about 2 years older than me, a younger sister, Jackie, who is about 2 years younger than me, and the baby is my brother, Steven, who is about 6 years younger than me. And so we are very close. You know, we spent a lot of time with our extended family. We were it was very happy home. And my parents always made everything fun, and it was very enjoyable. We fought, with the 4 siblings, but that was normal. So, yeah.
And one of the siblings you mentioned was Jackie. Mm-hmm. And Jackie is your why. Jackie is your why of what you do today, why you're sitting here today. Mm-hmm. Can you tell us about her?
Yeah. So she was, like I said, she's my younger sister. She was a little feisty, a little sassy. I shared a room with her for several years, and so we'd always get in little arguments and things that way, as sisters do. But she was also very loving and fun, and she loved sports. She played basketball and volleyball. She was very into pop music. She was a huge fan of the Backstreet Boys, because this is a while ago. Yes. So, Disney movies. So, yeah, she was a really special person.
And Jackie became sick. Mm-hmm. Can you bring us through that journey?
Yeah. So she was in eighth grade. So she was would have been 13, almost 14, and was just kind of getting more tired, run down. She was bruising a lot. She was, and it was in her basketball season with her junior high team, and just not able to kind of keep up, and getting a lot more bruises than you'd expect. So there was just something that seemed a little bit off. So I'd seen kind of had some blood tests done. Actually have an uncle who's a family practice doctor. So my parents always relied on his opinion and things as well. And so eventually, after a few months, we found out that she had acute myeloid leukemia. And so she was diagnosed when she was 14 in January of 1999.
Wow. What incredible thing to have to experience together as a family. I think of your parents. And unfortunately, Jackie passed away.
She did, yeah, about a year later after she was diagnosed in January of 2000. She was 15.
Can you bring us through a little bit about what that experience was like for your family from the diagnosis through, all of that you had to navigate as a family, and then her passing?
Yeah, so it was challenging, but I think, again, we were in a very lucky situation as well, because our parents were, very loving, and they were able to spend a lot of time with Jackie when she was in the hospital. So she was treated at a children's hospital in Chicago, because that was kind of the closest one to us, which is about 2 hours away from our home. So my parents were able to be there. She was in the hospital for about a month at a time, getting her treatment and just kind of recovering from the complications and things. So we would be able to visit on the weekends, because my siblings and I had school. My older sister was in college. So she actually was at college at the University of Illinois, which is about 15 minutes away from our hometown. So she was able to be home a lot. My grandparents spent a lot of time at the house with us while my parents were with my sister. And we were lucky that my parents had that luxury with my dad's job, and my mom stayed at home with us. So they were able to be spending time with her when she was needed, because she was needed. But then we were also able to kind of go up and visit. And even though it's hard, your sister's in the hospital, there also were times that it was kind of special. I loved Chicago. I love the city. I still do. So it was kind of a treat to get to go there and, just walk around the city, and we'd go pick out movies and kind of be able to see her in the hospital. We were shielded from a lot of the times when she was really sick, because we were home. And so my parents, kind of protected us from that. So she was in the hospital on and off for a few months. She ended up getting a bone marrow transplant that spring when she was diagnosed. My brother was a donor, which was really nice. We were lucky that he was a match. And so then that is, you have to recover a lot from that you're very immunosuppressed after you get a bone marrow transplant. So then she was able to come home, but still wasn't able to go out and do lots of things. We were also able to spend a lot of time with our extended family. So particularly my dad's side of the family with my grandparents, lots of aunts and uncles and cousins that were also very involved and would, stop by and spend time with us or spend time at the hospital. I remember one of the big events we were able to go to was my grandparents' 50th anniversary party, was that spring after Jackie had been discharged from the hospital. And then we had a kind of time at home in the summer, and she was, in remission for a while, recovering from her transplant. And then that fall, we found out that her cancer was back. And at that time, it's a lot harder to treat it and to get rid of it. So she went through a couple other therapies, was in and out of the hospital. At that time, most of the time she was able to be home. She wasn't in the hospital for as extended periods of time. We were able to take a couple really fun vacations as a family. So we did a Make-A-Wish trip in November of that year, and we went to New York City and got to see a show on Broadway. And, we did other things like the Statue of Liberty and, all kinds of fun things that trip. And then had Christmas. My sister got a karaoke machine. So Jackie got a karaoke machine that year for Christmas. And so the whole extended family had a big karaoke contest, which was very fun. And that tradition actually carried on for several years afterwards.
What did you sing?
So we sang Girls Just Want to Have Fun.
Oh, yes.
So my sisters and my mother and I. So I actually have a picture of that that I could show you too.
That is a core memory.
It is. So,
and I think about, the ages. Mm-hmm. You said you were 16.
So I was 16 to 17.
Yeah. And I mean, those are such, formative years. You're certainly old enough to remember and feel those emotions of all that you're going through. And as we've mentioned, Jackie really ultimately became your why of what you're doing. So how did you know? What was that moment of, this is what I want to pursue, this is what I want to do?
So it actually didn't happen for a long time. So I always knew I wanted to be a doctor from the time I was a little kid. I remember reading books about cardiology when I was in 5th grade. My grandparents had heart surgeries, and so I was very fascinated. And I was going to be a cardiologist. And later on, even around the time of Jackie, when she was sick, I thought I wanted to work in the emergency room. So I always knew I wanted to go to medicine. But I didn't, even after Jackie passed away, I didn't say, I'm going to go be an oncologist and do that. It never crossed my mind, actually, until I was in medical school. And we started learning about, about leukemia and things. And it just was like, I was very interested in learning more about it and what, just to see kind of what happened to Jackie and just from kind of almost a scientific side of things. And then I got more experience in working with, in pediatrics, and I was able to shadow a pediatric hematologist-oncologist. And I just found that I really enjoyed it. And I really loved working with the families and helping that, the patients. And so it wasn't really an aha moment. It was more just a journey along. And even when I finished med school, I wasn't sure. I also envisioned myself doing family practice and taking care of kids and adults of all ages throughout their lives. And I wasn't exactly sure what I wanted to do. And then I would say my residency program, I did both the internal medicine and pediatric residency in Milwaukee at Children's and Froedtert. And my second year, I did another rotation in pediatric hematology-oncology, and I was like, yeah, this is what I have to do. And I know it's because of Jackie. If that hadn't happened, I wouldn't have ended up there. But it was a journey. It wasn't an exact, there wasn't an exact moment.
And here you are today. You've been with Prevea Health and HSHS St. Vincent Children's Hospital for 7 years now.
Yeah.
This is what you do. Mm-hmm. You help fight a terrible disease that you lost your sister to. Can you tell me how does that experience with Jackie, all that you and your family went through, how does that translate today into what you are doing for children and families?
Yeah, I think it just helps put everything in perspective, right? So I have never been a parent of a kid who's been diagnosed with cancer. And I'm not going to say that I know exactly what that feels like, but I have been in a family that's been impacted. And so it just gives you a little bit more of a kind of glimpse into what their life might be like. And so a little bit more understanding in terms of what they could be going through, not just when they're in the hospital, but at home. And even too, I think it makes me remember a little bit more about the siblings of the kids that are there, because we don't get to see the siblings a lot, right? As the doctors, we see, usually the patients and the parents, and especially with the COVID restrictions and everything in the last few years, it's made it very challenging for kids to come visit their siblings when they're sick in the hospital. And so it just is a unique, I think, perspective, and just so kind of keeps things a little bit more personal, I feel like, as well. So it's just kind of a nice thing. I don't always share the story with my patients either, because it just doesn't usually come up, but I'm also willing to whenever they ask. So, it's a unique perspective and a special thing. I get to have kind of see both sides of it.
When you're, making rounds, or you're in the clinic, or you're seeing children who are, in the hospital, checking up how they're doing, anything with your day-to-day work, does Jackie come to mind from time to time? Yeah,
she does. I mean, often, I would say. And even not in my day-to-day work, but day-to-day life, right?
Yeah.
So, but yeah, there's definitely times, especially if there's a patient who's around the same age, or sometimes it's not even anything that's particular, but she just pops in. And and I remember her and say hi in my mind and know that she's watching down.
And probably really, really proud of her big sister. Incredible. And I imagine your parents are exceptionally proud of you. Your brother who did the bone marrow donation. How does your family feel about what you do today?
Yeah, I think they're very proud, and I think that they appreciate that it's kind of a special thing. They sometimes give me a hard time when I don't know their medical questions, because it doesn't fall into my area of expertise. But in general, yeah, they're very proud, and I think very happy. That's kind of where I ended up.
And you have a beautiful family of your own today.
I do. Yeah, my husband, Jason, we have 3 sons. Charles, who's 7, and Luke is 4, and Emmett is 2. So we keep very busy, and they keep us on our toes.
And I'd asked you a few questions before we sat down today, and I just wanted to know, things that you like to do outside of being this, this cancer-fighting warrior for all these kids across Northeast Wisconsin. You love to cook.
I do.
Tell me about that.
Yeah, so I do. I don't do a lot of it during the week, because by the time I get home and I'm just trying to feed the hungry children, but it is really enjoyable. It's just kind of like a zen place for me. So even if I'm just like chopping an onion, it's just kind of a calm place, and I enjoy kind of trying different recipes and putting things together.
What's the last thing you cooked that you're really, really proud of?
So I don't do it often, but I like to make homemade pasta. So pasta noodles. We had a girls' weekend a little while back with my older sister, and a bunch of my cousins. And I cooked for everybody. So I made homemade pasta and homemade like a tomato cream sauce with sausage, and it was a lot of fun.
Sounds amazing.
Yeah, it was good.
Sounds amazing. We cannot thank you enough for sharing your story with us. Is there anything you want to add about what you do, about Jackie's memory, or perhaps I imagine a lot of your patients and their families are going to be the ones hitting play on this, because they want to know more about Dr. Long.
Yeah. I would just say that I'm happy to talk about it. Like, it's been a long time. Jackie died 23 years ago, which sounds like longer than it really has. It doesn't feel that long sometimes. But I think that it's a good thing to talk about, and even with patients and families, and I'm happy to share and just kind of share her memory with everybody. And yeah, it's a special thing that we do, and I feel very privileged to be able to take care of these patients and their families and help them along their journey.
Well, Prevea Health, HSHS St. Vincent Children's Hospital, our community, and everyone that you care for, I mean this, truly, truly lucky to have you. Thank you for what you do for our patients.
Thank you. I'm happy to do it.
To learn more about Dr. Long and Prevea Pediatric Hematology and Oncology at HSHS St. Vincent Children's Hospital, please visit stvincentchildrenshospital.org. More great doctors' inspiring stories are available now on Plug Into Health, and there will be more to come. So be sure to check your favorite podcast platform for new episodes, or you can always find us at prevea.com/podcast. You've been listening to Plug Into Health with Prevea Health. To learn more and to submit ideas for future shows, please visit prevea.com/podcast. And please remember, the information provided in this podcast does not constitute medical advice. It is not intended to replace interactions with your healthcare professional. And if you are concerned about your healthcare, you should consult with your healthcare professional. You can learn more about Prevea Health at prevea.com. Thank you for choosing to plug into health with Prevea Health.